Today we're going to be using the spectral resonance technique, which uses the chart that's here behind me. What's different about this is not just color. This is fully saturated color. In other words, it's the greenest green you can get, the reddest red you can get. And so the colors are different. It's developed by a specialized process. Now what happens is I have people look at a color and talk about their issue, whatever that might be. And as they talk about it, there's a good possibility that the color will change. It will appear to disappear or to blend. And when that happens, that's indicating that they are dissociating. In other words, their brain is disengaging from their emotions. In order to conduct therapy well, a person needs to be engaged in their emotions for us to change them. So this tells me instantly when their brain is not engaged. And so we can adapt a process to change that. I have them close their eyes and I ask them present tense questions about what they're hearing, feeling, thinking about in this moment, to take them away from the issue that was disturbing them and bring them into the present moment. Then I ask them to open their eyes again, and voila, they see the color again, which means that if you can't see the color in front of you, you're not fully present. And if you can see it, you're engaged. And then we can do the other therapeutic processes, and they work far better. Now, many therapists know about dissociation, but honestly, what we're discovering is that there's a lot of dissociation that is so subtle, you can't tell it by looking at a person's face or hearing their dialogue. But this color will let us know, because the distortion will take place. And so we use that as a guide to keep the person engaged, which makes the whole process work far more better. We select one color at a time, and we select colors depending on what the issue is that the person is describing. Sometimes I'll have them look to the left or to the right, because we're accessing different brain hemispheres that way. The right half of both eyeballs accesses the left brain hemisphere. The left half of both eyeballs accesses the right brain hemisphere. And when there's a discrepancy between the hemispheres, for example, they may feel one emotion looking at the right side and none on the left side, that tells me that the left and right hemispheres are not working together. If we can get those congruent, working together, very dramatic changes can take place therapeutically. And so that's one of the other processes you will see. And so I ask them to tell me instantly when the color appears to blend or distort. And then immediately I have them close their eyes, and then we go through the present moment process. They come open their eyes again, and the color is clear, and we can continue the process. So that's why this works differently than other just normal face-to-face talk therapy. Okay, Kelly, glad you could be here today. Tell me what you're experiencing in this moment. How are you right now today?
In this moment, I'm feeling like I can't breathe.
Oh.
I have a lot of anxiety. I feel like I have a brick on my chest. I'm feeling some pain in my knees, and I'm very nervous and excited.
Okay, so let me ask you, have you felt this all day, or just feeling it now?
No, I felt this all day.
Okay, and tell me about what you would like to accomplish if we could do anything today.
Well, I would normally, when I feel like this, I'll have a glass of wine to calm me down, and I would like to not have to feel that that's necessary.
Okay, all right. But tell me specific objectives you would like to pursue. What's first on your list?
First on my list would be to not drink in my boredom, to not feel like I need to have 3 glasses of wine to go to sleep.
Okay, but also, do you not want the
want
tension in your chest to be relieved?
I would love the tension in my chest to be relieved.
Okay, maybe we could start with that first, you think?
Yes.
And do you think that's anxiety?
Yes.
Okay, pretty much that's anxiety. I think the other things may take care of themselves if we start with that.
Okay.
Does that make sense?
Yeah.
Okay, now you can open your eyes, and I'd like for you to look at the green band. Can you point at where the green is? Okay, look at the middle of the green, and describe particularly this heavy pressure on your chest first, if you would.
It just feels like the breath is stopping in my chest, and it's like something's on it and pushing down on it.
And do you have an idea of what that pressure represents in terms of feelings?
I'm pretty sure it's anxiety.
Anxiety. Okay, so you felt this before.
Yes.
Okay. Now, you still see the green okay?
Yes.
All right, now follow my directions. Without moving your head, just move your eyes to look to the right portion of that green band. As you look to the right, please describe those feelings again, exactly like you said it the first time.
I feel that the breath is stopping in my chest and there's a heavy pressure on it. And it's just hard to breathe. I'm very anxious.
And do you know what you're anxious about?
Anxious about fear, and today's been a different day than normal days.
Mm-hmm. And does it feel any different when you look to the right side and talk about it?
No.
Okay. Now, without moving your head, just your eyes, look to the left side. Okay. Please talk about the same thing on the left side, and let's just see what your experience is.
I'm just having trouble breathing. I'm very restless. The breath is stopping in my chest. It feels very heavy.
Okay. And does it feel any different as you look to the left?
No.
Okay. And you still see green, okay?
Yeah.
Okay. Look at the center of the green. Let me see if I can help you reduce the tension a bit.
It's blending.
Okay. Close your eyes then. Thank you for telling me. Close your eyes. Pay attention to the sounds in our surroundings. Every little tiny sound you can hear, and describe it to me. For example, there's traffic outside, but tell me each vehicle you hear or anything you can hear.
I think they're at a red light because it stopped. But I heard a truck and a car revving. It's windy outside.
Okay. All right, and tell me what your feet feel like in the shoes that you have on.
They feel fine.
Okay. And do you know what the weather's like outside? Can you describe that to me?
It's a little chilly and very windy outside.
Okay. Good, good. Okay, now open your eyes again. Do you see green back?
Good.
Okay, good. The green has returned. Excellent. All right, so pay attention to the heaviness in your chest. And what I'd like for you to do is to defocus your eyes as though you're looking through the green or beyond it. And pay attention to what you feel in your chest, the anxiety that you feel there. Take a deep breath, as deep as you can, a controlled deep breath, all the way in, all the way out. Okay, now focus your eyes as though you're looking at the surface of the chart for any speck of dust you can see. And think about the tension that you feel in your chest. Take another controlled, steady, low, long, deep breath, all the way in, all the way out. And then defocus your eyes yet again, as though you're looking through it or beyond it. Think about the anxiety you feel in your chest. Take another long, slow, deep breath. And then focus your eyes again, as though you're looking at the surface of the chart. And as you do that, think about the tension that you feel in your chest, and difficulty breathing. Take another long, slow, deep breath. That's good. All right. Now, do you notice anything different in your chest?
It's lighter.
Okay,
It's
good.
still there, but it's lighter.
Okay, good. Yeah, I wanted to ease it up for you before we took the next step. That's very good. So now try talking about the same thing again, see if it's any different.
Well, I feel very restless and anxious. The breathing's, the weight is gone, but I'm still just not having an easy time just to get the breath in and out.
Okay.
But the weight is gone.
Do you know what you're anxious about?
I'm anxious about the issues to work on, my insecurities and feelings of self-worth, of being confident in myself.
Okay. So those issues themselves make you scared and anxious, right?
Yes.
Okay. Close your eyes. We're going to go to another step. Okay. Now, I'd like for you to open your eyes and look at the bottom color. Tell me what color you see there.
Red.
Okay. We're going to test the same thing here. You don't have to use the exact same words, but characterize the feelings that are distressing you right now as you look at the bottom color, the red.
I have trouble feeling confident in myself and insecurities of being good enough
Mm-hmm.
and being accepted.
Okay. Okay, has that been a lifelong thing, but it's intensified today?
Yes.
Okay. And do you still see the color okay?
Yes.
Does it feel any different when you talk about it as you look at this color?
I'm just more emotional.
What kind of emotions?
Sadness.
Okay. Well, okay, that's pretty sad. Let's see if it changes. I'd like for you to, without moving your head, have your eyes look to the right portion of the red next to the frame. Talk about the feelings you're feeling right now and see what happens. See if it's any different here.
I feel insecure of being the right person that I'm supposed to be.
Mm-hmm.
Feelings of not being able to be accepted.
Okay, okay. You did great. Thank you for sharing that. Now look to the left side. Talk about the same thing. Let's see if there's any difference here.
I'm struggling with feelings of self-worth and being accepted from others and just accepting myself.
Does it feel any different
Yeah,
here?
it feels better over here.
Feels better? Okay, so it feels better on the left side. What I want you to do is memorize what you see on the left side. Take a deep breath. And then I want you to look to the right side, but picture what you just saw on the left side. Okay? You looking to the right?
Yes.
Just keep picturing what you saw on the left side. Take a deep breath here. Now talk about it again on the right side. Let's see if it's the same.
I'm struggling with my issues regarding being good enough and self-worth and being confident in who I am and being accepted by others.
Does it feel any different this time?
It's a little easier.
It's easier. Good. Okay. Look at the second from the bottom color and tell me what color you see there.
Orange.
Okay. Point at it. That's good. Okay. As you look at the orange, now this one could be more challenging, but this one could make the biggest difference for you. Please describe that issue again as you...
Everything's blended.
Yeah, I thought it might be. Okay, close your eyes. Let's get into the moment. Approximately what time of day do you think it is right now?
Around 3 o'clock.
Okay, and tell me about what's the date today?
It's the 19th of March.
And what's the temperature in this room like for you?
It's nice and comfortable.
All right. And what sounds do you hear?
Cars.
All right, good. Now open your eyes. Do you see orange again?
Yes.
Okay. As you look at the middle of orange, talk about the issue again here.
Okay, I'm having issues with my confidence in myself, with self-worth,
Mm-hmm.
being accepted by others just the way I am.
Mm-hmm.
Um,
What does it feel like when you talk about it here?
it's like when I say the words just as I am, I get emotional, but it's okay.
Okay.
It's blending
Then,
again.
okay, close your eyes. Let's get you pay attention to this moment. The comfort level of that chair, how would you rate it from 1 to 10, 10 being most comfortable?
About an 8.
An 8, okay. And do you remember how to spell my last name?
Do you want me to spell it?
Yes.
Vasquez.
Actually, it's Vazquez.
Oh.
It's a trick question. Hardly anybody gets that. Okay. You see, so we need to have you let me know when it changes, because I'm going to do a procedure, and it'll work only if you're engaged with the color you see. And so basically you need to be in that feeling without dissociating from it for the process to work, okay? And I'll guide you through that, okay?
Mm-hmm.
That makes sense to you?
Mm-hmm.
Okay, open your eyes, look at the middle of the orange. Okay. Describe the feeling that's been disturbing here. It's self-perception.
Yeah, I feel like I'm not accepted in in my own personality, the way that I am.
Okay. Put your right hand over your right eye and look at the middle of the orange. Think about not being accepted the way you are. And if you see black,
I do.
okay, close your eyes. Okay, remember the black you just saw. Switch hands. Look at it with your right eye, but recall the black you just saw in the orange with your left eye. Open your right eye. Focus on not feeling accepted as you are.
It's black again.
Okay, remember the black. Close your eyes. Memorize the black you saw with your right eye. Switch hands. Remember the black you saw with your right eye. Look at it with your left eye. The middle of the orange. Just
Okay.
keep remembering the black you saw with your right eye.
Okay.
And when you see black,
I
let me
got
know.
black.
Okay. Memorize this black. Close your eyes. Switch hands. Remember the black you just saw with your left eye. And look at it and tell me if you see black. As you look
I'm
at
good right now.
See black?
It just went black.
Okay. Good. Okay.
And
Close your.
it went away.
Well, that's
No,
okay.
it's
No,
back.
it'll come back and
Okay.
forth. But close your eyes. I want you to remember it when it did come. What did it look like?
Okay.
So close your eyes. Switch hands. Remember the black you just saw with your right eye. Tell me when you see it with your left eye.
I have it.
Okay. Close both eyes. Put your hand down. Now open both eyes. Talk about the issue and see what happens this time.
I struggle with feelings of insecurity, self-worth, being good enough just like I am, being accepted by others.
And what's your experience this time?
Well, the color is still there.
But how do you feel?
I feel like it's okay. I mean, I'm not ashamed of myself.
So there's a difference. You don't feel so disturbed about not being accepted as you are?
Yeah, I feel more confidence in myself. Like,
Okay.